Cardiomyopathy is used to describe a disorder that affects the heart muscle. It is characterized by the thickening, stretching, and stiffening of the heart, affecting the ability of the heart to pump blood. Types of cardiomyopathy. Cardiomyopathy can affect anyone at any age and may have no known cause. These are the three major types of cardiomyopathy. Dilated. This is the most common type of cardiomyopathy and is characterized by rapid degeneration and diffused inflammation of heart fibers, causing ventricular dilation, atrial enlargement, and impaired systolic function. Clinical manifestations include fatigue, decreased exercise capacity, dyspnea at rest, orthopnea, and paroxysmal nocturnal dyspnea. Its causes include 1. Cardiotoxic agents: alcohol, cocaine, doxorubicin. Genetics: coronary artery disease, diabetes, hypertension, myocardial infarction, myocarditis, HIV. Congenital heart disease. Complications in pregnancy. Cardiomyopathy can be asymptomatic and shortness of breath, fainting spells, or chest pain may only develop in the later stages of the disease. Diagnosis is confirmed through ECG, echocardiogram, stress tests, and more, which the nurse may assist with. In some cases, cardiomyopathy can develop quickly and exhibit severe symptoms and complications. Prompt treatment is essential to control the progression of the disease, reduce the risk of complications, and prevent sudden death. Nurses play an essential role in caring for patients with cardiomyopathy, from assessment and identification of at-risk individuals to providing treatments such as drug therapy and surgical interventions. 1. Assist in self-care while promoting independence when tolerated. Providing care to the patient ensures that the patient's needs are met while reducing efforts that compromise cardiac workload. Encouraging participation in self-care activities, if tolerated, allows the patient to maintain a sense of control and independence. 2. Schedule interventions with rest periods in between. Scheduling interventions and procedures with rest periods ensures that the patient's needs are met without increasing oxygen demand and cardiac workload. 3. Monitor for an increasing incidence of activity intolerance. Increasing activity intolerance may indicate increasing cardiac decompensation. 4. Encourage the patient to adhere to a graded cardiac rehabilitation program. Patients with cardiomyopathy have irreversible cardiac dysfunction. Adhering to a graded cardiac rehabilitation program can help strengthen cardiac function without overexertion. 1. Assess heart rate, rhythm, and pulses. To compensate for decreased cardiac muscle contractility, the patient with cardiomyopathy will experience tachycardia. Decreased peripheral pulses are also an indication of decreased cardiac output. Pulses may be irregular or strong beats alternating with weak beats, pulsus alternans. 2. Monitor blood pressure. Hypotension can occur in advanced cardiac failure when the body is unable to compensate for the loss of cardiac function. 3. Assess and monitor urine output. With decreased cardiac output, the kidneys will respond by retaining sodium and water, decreasing urine output as fluid shifts onto the tissues. 4. Assess diagnostic studies. A chest X-ray may show an enlarged heart and pulmonary congestion. ECG can show ST segment depression and T-wave flattening due to myocardial oxygen demand. Interventions. 1. Encourage the patient to rest. Rest is essential to improve the efficiency of cardiac contractility and decrease myocardial workload by decreasing oxygen consumption. 2. Provide supplemental oxygen. Supplemental oxygenation increases oxygen availability for myocardial uptake to prevent hypoxia in patients with cardiomyopathy. 3. Administer medications as indicated. Medications such as antidiarrhythmics, vasopressors, and diuretics can help control the progression of reduced cardiac output. 4. Prepare for pacemaker insertion. A pacemaker may be required to keep the heart beating in a regular rhythm. The nurse can instruct the patient on precautions following the procedure. 2. Administer oxygen as ordered. Increased oxygen delivery to the cardiac muscle helps the heart contract effectively. This aids in the gas exchange process. 3. Ask the patient to demonstrate pursed lip breathing. Pursed lip breathing helps the patient slow their respirations and release trapped air and CO2. 1. Control blood pressure. The following medications are for patients with cardiomyopathy that help regulate blood pressure. 1. Angiotensin-converting enzyme inhibitors, ACE inhibitors, relax veins and arteries to control high blood pressure. 2. Beta blockers control blood pressure, angina, and irregular heartbeats. Entresto, a combination of valsartan and sacubitril, enhances blood flow, dilates blood vessels, and lowers blood pressure by decreasing the sodium levels, sacubitril, and preventing constriction of the blood vessels, valsartan. 2. Maintain sinus heart rhythm. Stabilize a regular heart rhythm with the following medications. 1. Amiodarone treats irregular heartbeats and assists regulation of the heart rhythm and rate. 2. Digoxin strengthens contractions and decreases heart rate. 2. Adjust the dose when amiodarone is initiated. Medications that lengthen the QT interval must be adjusted to regulate heart rhythms. 3. Teach the recommended diet. A well-balanced diet will prevent worsening hypertension and promote heart health. Emphasize fresh produce, whole grains, lean proteins, nuts, seeds, and low-fat dairy. 4. Assist the patient in meal planning. Teach the patient about the dietary approaches to stop hypertension, eating plan to control blood pressure. Assist the patient in creating their meal plan. The following food sources should be avoided. 1. Red meat. 2. Sodium. 3. Processed foods and packaged snacks. 4. Beverages with added sugar. 5. Alcohol. 6. Fried foods.